World Animal Protection recently conducted a study to measure antibiotic resistance genes in public waterways near intensive farms in 4 different countries. Before going through what we did, how we did it and why, there's a few terms to get to grips with. Firstly, antibiotic resistance happens when bacteria can resist the effects of antibiotics that would normally kill them. As such, these bacteria are often called superbugs. Antibiotics have been used to treat and prevent death from bacterial infections for decades, but as we use these drugs, bacteria have developed defense strategies to make them less effective. Superbugs contain genes that carry the genetic code that enable them to resist antibiotics, known as antibiotic resistance genes, or ARGs. And these ARGs are important as they can be transferred between bacteria in the environment. You're possibly wondering why World Animal Protection are conducting this research. Animal welfare is our priority as an organisation, of course, but it's impossible to ignore the interlinkages between the health and welfare of humans, animals, and that of the environment. In fact, it's a useful campaigning tool for us, since we can bring animal welfare up the global agenda and into more people's hearts and minds by showing the connections with these urgent global issues, particularly in countries where little is known about the importance of animal welfare. We believe that working towards solving animal welfare issues also plays an important part in solving other urgent issues that impact humans, animals, and the environment, like climate change, depleting natural resources, and in this case, the public health crisis. The next question you might have is why intensive farming? Well, 3/4 of the world's antibiotics are used in farming, and an estimated 67% increase in their use in livestock is expected between 2010 and 2030. Antibiotic use in farming, along with other uses, drives resistance and contributes to this global issue. And superbugs can be transmitted to humans by direct contact with the animals, through the food chain and through the environment. In terms of pig welfare, antibiotics are used to prevent infection in very poor conditions on intensive farms. For example, pigs experience painful procedures like castration, tail and teeth cutting, which are common practice, and pigs are often given antibiotics to prevent the wound becoming infected. Piglets are separated from their mothers at a very young age, leading to stress and a reduced ability to fight infection, which makes them more likely to get sick. Intensively farmed pigs are overcrowded, making infectious disease spread easily and fast. And finally, combinations of all these different practices across the whole system means that an overuse of antibiotics is inevitable. And we know this because pigs housed in good welfare conditions have very low antibiotic use.
หมูในฟาร์มอยู่แล้วนะครับเราพยายามที่จะชี้ให้เห็นอยู่แล้วว่าฟาร์มหมูที่มีสวัสดิภาพที่ไม่ดีเนี่ยนอกจากมันจะส่งผลกระทบต่อผู้บริโภคในฐานะที่คุณกินหมูแล้วเนี่ยถึงแม้ว่าคนที่ไม่ได้กินหมูหรือว่าอยู่รอบๆฟาร์มเนี่ยก็ได้รับผลกระทบจากฟาร์มหมูลักษณะแบบนี้เช่นเดียวกันครับ
We collected and tested water and sediment from public watercourses around intensive pig farms in Canada, Spain, Thailand and the USA. We also collected groundwater near a high-intensity pig farming area in Spain. All samples were analysed for antibiotic resistance genes by accredited laboratories in those countries, and we interviewed local residents living close to these pig farms. So what did we find? We focused on testing for genes encoding resistance to the classes of antibiotics that the World Health Organization classify as critically or highly important to human health. These antibiotics are those that are the sole or one of limited available drugs to treat serious bacterial infections in people, or are those used to treat infections in people caused by bacteria from non-human sources, or bacteria that may acquire resistance genes from non-human sources. We found genes that encode resistance to the highest priority critically important antibiotics in all of the countries we sampled. We also found several other genes encoding resistance to other critically and highly important antibiotics. In Spain, the groundwater tested in a high-density pig farming area contained genes encoding resistance to 2 highest priority critically important and 1 highly important antibiotic, which we measured at concentrations between 5 and 200 times higher than baseline values. These genes are likely present due to the use of animal waste as fertilizer in this high-density pig farming region, with the comparison baseline levels being substantially lower. We spoke to local communities in Canada, Spain and Thailand. A local small-scale pig farmer in Canada compared intensive farming to his own method of farming and the ethics of the system, including the treatment of animals. In Spain, a local resident described concern about the water use and pollution associated with intensive farming, as well as the impact on people's enjoyment of the outdoors and, of course, their health. Local residents in Thailand
ข้าว
explained
มัน
the
ก็จะไม่ค่อยได้
situation in their
ใช่ไหม
own
เพราะว่า
words.
มันมีพวกน้ำยา มีพวกขี้หมูอ่ะคือมันเยอะไปพอมันลงที่นาปุ๊บเนี่ยตรงนั้นก็ต้นก็จะเสียหรือตายไปเลยแล้วส่วนมากก็ระบบนิเวศนั่นแหละก็คือพวกปลาพวกอะไรเนี่ยก็จะไม่มีอยู่ก็คือมันเค็ม
ได้2 ปีมาฟาร์มข้าวมาจบเลยจากดินที่เป็นดินอย่างนี้นะก็เป็นดินที่เน่าเฟะน้ำเนี่ยใช้ได้เฉยๆนะกินไม่ได้นะเป็นกลิ่นเหม็นมันเค็ม
ในคลองเนี่ยเชื้อมันต้องยังมีอยู่เราไม่อยากให้เกิดขึ้นมาเลยเพราะที่ผลกระทบมันเยอะเส้นนี้พอน้ำมาเยอะเนี่ยข้าวจะไม่ได้เลยถ้าเป็นไปได้ทำไมไม่จัดระเบียบให้ฟาร์ม
There is reason to be positive, as there are solutions that are better for animal health and welfare, the environment and public health. In the UK in 2019, for example, antibiotics administered to Soil Association organic pigs was 77 times less than the average antibiotic use in pigs in the UK, and this is due to responsible husbandry practices that enable pigs to live better lives. One final important solution to reducing antibiotic use is meat reduction. If people ate just 165 grams of meat per day, antibiotic use in farmed animals could reduce by 22%. Going further and reducing global meat intake to just 40 grams per day could reduce antibiotic use by 66%. I'd like to thank my co-authors and colleagues in all the countries who collected the data under very challenging circumstances in 2020, and of course all the wonderful volunteers and local community interviewees. Thank you for listening.